Welcome back to the channel Health Dose. This is Dr. Anik, and today we will talk about the course which is required in order to perform under the test DHA, Dubai Health Authority, and we will discuss every point. And I hope if you have any questions, you can comment and let me know. Even I have my WhatsApp number mentioned, so you can contact me directly as well. And if you are looking for one-on-one sessions of tutoring for DHA exam, I teach it as well. So let's get started with the course. And obviously this is the first thing which one should know, which things are to be covered and which are to be conquered in order to conquer the test DHA. As you can see, the course is quite hefty, and it all starts with toxicology, which is the most important thing. And toxicology is basically everything that you need to know about toxic substances, how to control them, how to give medical emergency treatments, and how to control. For example, let's talk about lead poisoning. What are the symptoms? How can you find out if there is a lead poisoning if the house is not being renovated, has not been renovated since last 50 years or 60 years? So it means there are many chances that the house has the paint that is being chipped off, and it can be consumed by children, and it can also lead to lead poisoning. So things like that are very important. And next is medicinal chemistry. As you know, from 2021 it has been added and integrated in the course of DHA, and to be least precise, 10 to 15 questions almost regularly come to DHA exam. So it is very important to know the structures of the medicinal compounds, and also it is very important that we should know which medicine has which structure and which medicine give how many kinds of metabolites, and including the metabolitical structures as well. So here goes our second thing: sterile and non-sterile compounding. As you know that in sterile production and compounding, they have multiple kind of standards, including the clean room standards, ISO classification of clean rooms, and how to sterile an area, how to make sure that non-sterile production is being totally done, under which circumstances, under which regulations it comes. So this is how it goes. And this is the third one, and pharmaceutical and biopharmaceutical. So these questions are very, very important in order to pass DHA exams, because pharmaceutical and biopharmaceutical calculations, biopharmaceutical, it includes AUC, as you know, and pharmaceutical, it means that you have to find the dilutions. Biopharmaceuticals mean, for example, area under the curve. It is one of the example of biopharma, and pharmaceutical means that, as you already know, that if you have two different concentration based elements in front of you, and if you have to make sure that you have to prepare or compound another percentage of that particular element, so this comes under pharmaceutical calculations. And the next one is calculations. So calculations have a lot of different types of questions, where these are very diverse. And one of the most important tips that I want to give to my students is that make sure that you memorize at least 1, 2, 3, 4, 5 At least five formulas should be revised on daily basis, and it should be practiced on daily basis by using various platforms. So calculations are such a thing that they are very volatile, and if you can't remember the formula on the time at the right time, so the things will literally go out of your hand, and it will lead to further more confusion. So you have to practice a lot. Next is pharmacogenomics, and it also includes infection control, pharmacokinetics, as well as ADME, uh, and pharmacodynamics also is included. Uh, Please make sure that you do everything that is there. So dynamics and kinetics both are very very important. Pharma care and disease management is very important as well. uh, Medication safety, yes, it is one of the most important things that you have to remember in test, because in case of like OTC products, so it is asked that what can be the side effect, what can be the toxicological effect, what can be anything can be asked, and it will be very confusing. So if you don't know what are the OTC products, which OTC products can cause these kinds of side effects, toxicological effects, and anything like that, so you have to make sure that OTC products are being uh, always remembered, and medication, and which policies are very important in order to make sure that OTC products are not being misused. These are very important as well. The next is pharmacy laws and ethics. Laws and ethics, these are very very important as well, because at least 10 to 15 questions are nowhere. They will definitely come in every DHA exam, and if you don't know the ethics, if you don't know what are the laws of pharmacy, so it will be very difficult. In order to pass the exam, you have to make sure that laws and ethics are being memorized by heart. The next is clinical pharmacology and therapeutic decision making. Yes, make sure that clinical scenarios are being covered, and if you are very confused in clinical scenarios, I have made a whole video for it, and this whole video will help you. It includes 10 bonus points that will help you to crack any kind of clinical confusion based MCQ, and it is also making sure that you cover all the clinical scenarios, and it includes a bonus tip as well. So if you want to work on your clinical pharmacology based MCQs, so I will put the link in the description, and make sure that you follow that video, and you if you have still any questions, you can always write it in comments, and you can always reach me out on WhatsApp as well. So the most important thing in order to crack this course is making sure that you don't miss any of these. Make sure that you understand the question, make sure that there is nothing left behind in choice, or you can say in anything. At least this course line is very very important, and learn through every angle, think with every angle, and make sure that every information stays in your mind. If you are focusing, and if you are unable to do anything about your memory enhancement or anything like that, make sure to ask me. And if you buy the course, which is actually very versatile, and it is very helpful, as I have made sure that this course uh, has been devised properly for every kind of student, including the bright ones, and specifically those who are not those who have left studies and it has been a while that they haven't studied in a while. So make sure that I make sure that this course covers everyone. So if you are looking for someone who can teach you and who can make sure that the person can actually cover things up for you, so make sure to subscribe the channel. Reach me out if you have to. I do one-on-one sessions, and it is very best for the student because it's student, and student has my focus, the entire focus, and I can also read my student well and work on him or her so they can perform better in exam. Subscribe, and let's see you in the next video. Hit the bell icon for personalized information. Guys, please support. It is very crucial and it gives me a kind of motivation to make new content for you. So please make sure that you subscribe the channel and hit the bell icon for personalized notification. I post 3 MCQs on daily, which are very important. They have been seen in DHA exams back and forth, and these are very important. So if you follow me, if you subscribe to the channel, then it is possible that you can go through these 3 MCQs on daily basis and making sure you memorize them. All right, guys, I wish you good luck. Please take care of yourself, and we will meet in the next video.